Mōrena koutou katoa, ko Tina Harrison tuku inga.
Kia ora koutou, ko Jackie Hampton toku ingoa. I'm going to talk at the end of Tina's kōrero about skills matter.
Okay, so put your hand up if you have a hip health coach or support worker in your practice. Okay, put your hand up if you know how those roles work within your practice. Not bad, not bad. Okay, so there's three, the role that the IPMHA model was developed is there's three roles: the health improvement practitioners, the health coaches and the support workers. In some areas, those roles, like the health coach and the support workers, are a flex model. Mostly not in Auckland, usually more around the rest of the country. The idea of those roles is they're supposed to be low or no referral criteria, low wait rate, going off the previous slide, low wait times. We look to see if it's same day contact, or at least 50% of those that are seen as same day contacts, with a warm handover from anybody in the practice. Really often in the materials it'll say GP, but it could be the receptionist, it could be your nurse, it could be anyone in there that said, hey, you know, let's have a chat with one of those roles. So the idea is that any door is the right door, so it really doesn't matter whether it's a hip health coach or support worker in the first instance. The idea is that they're able to access somebody. The hips usually, or it's a good idea to have access to the PMS so that they can actually contribute to the notes in there, so that the entire practice is working as a team. It is not just mental health or addictions that the HIPS health coaches and support workers are able to see. It's any health issue that can present in a behavioural way, which we know that it's all of them. They can work with individuals, family or whānaus, and it can also be group-based intervention. So within practices we have a lot of HIPS that are facilitating groups for things like diabetes, all sorts of things. Health coaches have formed walking groups in line with green prescriptions and things like that. And the population pathways are population health focused and behavioural health. So the idea is that the teams work as a close relationship with the primary care. It's an evidence-based model, and the core training pathway is that the HIPS, the idea of the implementation model is that they've started some core pathways within the GP practice that's integrated, and again that it could be working with specific areas, and a common one is diabetes. We have the cardiac, trying to think what it is, recovery pathway that started in some of the ones. So it can be really specified as to what the practice is needing, what is being seen. It could also be working with the practice nurses around making phone calls and touching bases with people that we know they're needing to come in for a repeat script. You know, what are they going to need before they come in there? Those sorts of things. The idea is that they're often working in what we call a high impact way. So they can be seeing up to 10 or 11 patients today, but usually they're sitting somewhere between 6 and 10. And again, it's working with often where we're seeing low satisfaction outcomes, working in those low mood areas again, working with people that are presenting with chronic conditions and working behaviourally. Often the HIPS will work with the health coaches because the health coaches can have an ongoing engagement, where HIPS are working with the presenting issue on the day for that person. The pathway for return access with HIPS is patient driven. So if that's what the patient is asking for, then it's by that. It's where necessary, the HIPS and health coaches can work with secondary services for ongoing engagement for specific areas, for example, addictions and mental health.
Hey, so what I'm going to talk about is the Skills Matter program under Te Pou, which is funded by Te Whatuora, and that includes 12 postgraduate programs for mental health and addiction. And so half of which is the new entry to specialist practice, but the other half is with 3 providers at Massey, Otago and Auckland is the clinical leadership in nursing practice. At Otago, based in Wellington, we have the free funded postgrad diploma in cognitive behavioural therapy that is often frequented, and there's many GPs that do this training. There's the core skills in infant, child and adolescent mental health and addiction interventions, and that's based at Auckland Uni. And the assessment and treatment of coexisting mental health and addiction intervention, and that again is at Otago and Auckland. So these are free. These cover 1 to 2 years, and do access it. We also have 2 postgrad certificates in adult forensic practice. Just FYI. So we have about 600 registered health professionals who enrol in these 12 programs a year. So it's quite a big chunk of the workforce. The other free workforce development program specifically targeting your primary care nurses and practice nurses is the Mental Health and Addiction Credentialling Program. Again, we've had about 700 primary care nurses go through this program. It consists of 5 study days over 4 to 5 months, and it includes professional supervision and really just honing in those skills for brief focused intervention. We have had Bruce Errol teach on it, David Kadaya, and a sort of a host of mental health nurse specialists, addiction, etc. So I highly recommend it for your practice nurses, and it is actually overseen by Te Ao Maramatanga, which is the College of Mental Health and Addiction Nurses. So if you're interested in that, find me on the Te Pou website or that email address there. Yeah. So again, there we go. That's what I wanted to say. That's it.